I'm Dr. Rick Martinello, the Medical Director for Infection Prevention at Yale New Haven Health. Currently in the United States, there's a small number of people who have been infected by COVID-19. The overwhelming majority of these individuals acquired this infection while traveling in China, and a very small number of persons acquired COVID-19 infections due to their household exposure to the travelers. For people who have become infected by COVID-19, their illness seems to be very similar to that for people with influenza. We continue to see a great deal of influenza both in our emergency departments and our physician offices. Today in the United States, we are not seeing any sustained person-to-person transmission, so the risk of developing an infection from this coronavirus is near zero. Right now, as we're still seeing a great deal of influenza, there's much more risk for developing infection from influenza or another respiratory virus. In order to protect our patients and our staff, it has become routine for our physicians and our staff to ask patients about their travel history and whether or not they may have been in contact with somebody who has been exposed to the novel coronavirus. While we are not seeing any COVID-19 in Connecticut, we are still seeing a great deal of influenza, and we expect that this will continue through April. Of course, the best thing that you could do to protect yourself against influenza is to get your flu shot if you haven't already. Flu shots are still available widely in the community, and so we do ask that you please do go ahead and get your flu shot. Other things that you could do to help keep yourself healthy include washing your hands and making sure that if you do get sick, you stay home to prevent the spread of your germs to others in the community. We have been getting a lot of questions about whether or not packages that are received in the mail may be a risk, or even that eating out at restaurants may be a risk. We do not have any concern about packages that people are receiving in the mail. However, as a matter of routine, it's always good practice to wash hands after handling mail. Also, we do want to reassure people that eating Chinese food or eating in a Chinese restaurant is not a risk factor for getting sick with COVID-19.